Hello and welcome to Courageous Doctors, the new show for you and your doctor. On this show, we'll cover Obamacare updates, other interesting healthcare stories, and health and safety tips. Now let's begin. The first story is a very unusual one on Obamacare updates. 3 New Jersey former governors, Governor Byrne, Governor Cody, and Governor Corzine, have made a very unprecedented statement, writing a letter to Governor Christie asking him to stop the practice that the Blue Cross Insurance Company is doing now to take a new company they called Omnia, which limits the doctors that you have a right to go to. Basically, Blue Cross, as you know, has always been our wonderful insurance company that it insures half the people in New Jersey. It was the first company since the 1930s, since the Depression. We have a long history of the Blues going out of their way to give us good health insurance. So it is unprecedented that the Blues are restricting the doctors in this way, but even more unprecedented, and I've never seen it, that 3 former governors are asking Governor Christie to stop it. Let me read you just a couple paragraphs from their letter found in the opinion page of the Star-Ledger, dated February 18th, 2016. Horizon Blue Cross Blue Shield of New Jersey, the state's largest insurer, remember they insure half the lives in New Jersey, has rolled out a new insurance product, the Omnia Health Alliance, that threatens to erode the bedrock, strong words, of New Jersey's healthcare marketplace at the eventual peril, we believe, of dozens of hospitals and tens of thousands of healthcare consumers in New Jersey, especially the uninsured and the underinsured. I'll skip and just read one more paragraph, but this is up on your screen so you can see it. Horizon's plan gives its insured members a monetary incentive to seek care at hospitals it considers more qualified than others based on non-transparent criteria it alone has selected and did not vet in any public forum. So I don't really know what non-transparent here means, but basically, come on, the Blues have insured us since the 30s. They insure half the people in Jersey. If you're that big, don't fool around. Don't tell patients what doctors or hospitals you can go to. Even if you technically have a right to legally, if you're going to be that big, then you have a tremendous responsibility to not be part of our problem, be part of our solution. With all the pressure on us, at least help everybody in the state in this horrible, horrible time of recession and depression. Help everybody in the state to be able to go to the doctor they want to go to. You're that good, you're that big, you've been there since the 30s. So I think this is unprecedented. These 3 governors going out of their way to say this. There must be something terrible happening. This is really horrible, a word I almost never use, but this is horrible. Please encourage the Blues to be the company they've always been for us since the 30s. Help every patient to be able to choose the doctor of their choice. Now let's move on. CNBC said that the researchers at the Avalari company found that the middle class in America, this is about Obamacare, cannot afford the exchange insurance premiums and out-of-pocket expenses. The Hill says that the average exchange premium is $408 a month without subsidy. With subsidy, it's $294 a month. So Health and Human Service reports that 83% of people using exchanges are actually getting subsidies, so they're saving $100 a month. But probably what Avalari was talking about is that everybody else in the middle class can't afford exchanges, so they're not using it. The New York Times says that 12.7 million people signed up for the exchanges in 2016. Moving on, the USA Today said the government will spend $1 billion over the next 2 years on cancer research, and our Vice President Joe Biden is doing a great job trying to pull together all the great leaders in cancer research in this country so we can find some major cures. And the New York Times says the government's going to spend an additional $1 billion to stop the overuse of prescription pain medicine.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Hi, my name is Marla Gruber, holistic health coach, smile expert, founder of the WIN program for children, a yogi trainee, and a mom to 2 teenage children. I'm excited to introduce into Dr. Barry's office my services of increasing your child's positive energy. My goal is to get the body comfortable so it can function at its full potential, enabling them to smile from the inside out daily. I will help both you and your child understand that being healthy is not just an absence of disease, it's having vitality. I believe that life is a journey, not a destination. I will help you enjoy the process of guiding your child to living a better quality of life and being the best that they can be. I look forward to helping you. Thank you for listening and keep smiling.
Now let's talk about other healthcare news. The Wall Street Journal said that a commission is being set up on global health risk, put together by the United States National Academy of Medicine, the Melinda and Bill Gates Foundation, and the Rockefeller Foundation. They're calling on the United Nations and other large countries to give $4.5 billion a year to prepare for pandemics. And now for the major breaking news these last couple of months. The Washington Post says that the Zika virus outbreak, as you know, in the Caribbean and South America, that's the virus that's spread by the same mosquito that causes dengue fever, chikungunya fever, West Nile virus, malaria. These mosquitoes are causing this new virus, Zika virus, which actually is a very mild illness, except that in fetuses of pregnant women, it damages the baby's brain. Now, there are some people that actually have gotten Guillain-Barré disease, a paralyzing disease. Most people have a very benign illness. But the problem is there's a major plan. The government under President Obama has asked our Congress for $1.8 billion to have a three-pronged approach at this virus. The first is National Institute of Health is trying to make a vaccine, which will take a couple of years, because it's like other viruses like rubella, when we used to have congenital disease. If there's no way to stop you from getting the virus, unless you aren't bit by a mosquito, it's better to have a vaccine to protect you from getting the disease. The Center for Disease Control, the CDC, is looking at the other two areas of both educating the public as well as trying to find ways to prevent us from getting bitten, either destroy the mosquito population. Now, unlike the mosquitoes that we're more commonly used to that cause malaria and some of these other diseases, these mosquitoes, first of all, live more indoors, so spraying outdoors isn't going to help. You can try to get at the larval pools of the mosquitoes, and we're looking for bacteria and things that will infect and kill the larva stages. And a very interesting company in Britain called Oxitec has developed and is now using it, a genetically modified mosquito that causes infertile offspring that'll kill off the population of mosquitoes, and that's currently being employed. But basically, you can't just spray outside because these mosquitoes live inside. They also bite during the day and night, so it's very hard to know when to protect yourself. And right now, young women in South America and Puerto Rico and these other Caribbean countries are just trying to keep from getting bitten. The other thing is Australia is trying to find a spray that's good for the indoors, and one that's not resistant. So there's a number of different approaches going on, and we'll stay tuned for that. But there is, and the Star Ledger reports on this, approach that the CDC wants you to do, that if you think you've gone to this country, and you may have had the disease, please get tested, especially if you're pregnant. And if you have a baby born with a small head, microcephaly or brain damage, please find out if you were exposed to this virus. The other thing is that although the virus lives in the blood for only 1 week, we think it might live longer in the sperm. So the real concern is, say you go to the World Cup in Brazil and the guys go there to see a soccer game or wherever, and they come back and they may have had the illness and not even know they had it. Unprotected sex or like that, they may be able to transmit to women and get them pregnant with an infected virus. It may live longer in the sperm. We're also not sure if it's transmitted through breastfeeding and if that causes a problem. So there's a lot of research Center for Disease Control and National Institute of Health are doing, and that's why they asked for the $1.8 billion. All right, let's move on. New Jersey State Department of Health said there's another salmonella outbreak. Oh boy, this time linked to Garden of Life raw meal products. I think they recalled their chai products. Star Ledger said that the state panel that was reviewing the sale of St. Michael's Hospital to Prime Healthcare recommends it go through. And so that's good to save St. Michael's Hospital. Prime Health now also runs St. Mary's Hospital in Passaic and St. Clair's Hospital in Denville. Let's see, Star Ledger, this is interesting. They passed a food stamp. The legislature passed a food stamp bill for the unemployed. Apparently there was some technical thing, and this is different than the usual food stamps. But they said, unfortunately, the governor's going to reject it, which I don't understand. Lastly, health safety tips. The New York Times says that the Government Accountability Office is still finding flaws in the FDA's, Food and Drug Administration's, ability to track drugs for safety. There are a lot of problems. The FDA certainly needs more manpower and funding. A major problem the FDA is also having, and we spoke about this on a previous broadcast, is they're way behind in trying to get some of the generic drugs out, thousands of drugs that could really help with competition and get drug pricing down. And they just really need help. There's so many drugs to review for safety. A drug that is particularly important to me is that as a pediatrician, we've lost our drug for ear pain. It's a simple benzocaine in the ear. The FDA removed it, and we're trying to get Congress to put pressure on the FDA to please give it back, because, I mean, I can't think of anything worse than being up all night if you're a child with an earache and not having anything to give them for the pain. So we really hope, we know the FDA is undermanned, and we hope they can get the funding they need, and we hope they can get these drugs back on the market, especially all the generic drugs, but other drugs as well, and keep us safe and have the ability to do that. And but if you have a child with an earache, please call your congressman and tell them to put pressure on the FDA. We know you're understaffed and behind, but please give us back our benzocaine eardrops. Let's see. The Star Ledger reported that New Jersey is going to spend $17.5 billion over the next 5 years to improve our sewage water treatment, especially in the sources of drinking water coming from 3 rivers, the Hackensack, Passaic, and Ramapo River. The Associated Press talked about those hoverboards that the kids love to ride and drive around on. They're still causing problems, bursting into flames. And some large companies that are transport companies won't even package them. Finally, the Star Ledger, and you can refer to your screen on this, looked again at the federal guidelines on adding sugar and other foods. Again, they want less than 10% of the daily intake in calories to be from sugar. That's 50 grams, equal to like a 12-ounce can of soda. They're also still concerned about decreasing our sodium intake and eating less processed meats, but they seem to be less worried about cholesterol. Well, that's our news program for today. As always, we thank you and look forward to your comments, and we will share your comments next week. And please enjoy the rest of the day.